Good afternoon and welcome. Thank you all for joining us for the 2019 webinar series of Jonas Nursing and Veterans Healthcare, which is the signature program of Jonas Philanthropies. Founded by Donald and Barbara Jonas, our program works in partnership with schools of nursing across the country to identify and invest in high potential doctoral nursing scholars. And we welcome you today to our webinar entitled Career Planning for the PhD and the DNP Prepared Nurse, which is hosted and presented by our Alumni Council. And just as a reminder, today's webinar is being recorded. We are the first and only privately funded program in the nation with a presence in all 50 states, and we're focused on the commitment to the nursing profession and veterans healthcare with over 1,200 scholars funded to date. And we remind everyone to be sure to follow us on our social media, such as Facebook, LinkedIn, which is at Jonas Philanthropies, or on Twitter at Jonas Impact, or on our website, jonasphilanthropies.org. And once today's webinar is recorded, you can check it out as well as other webinars that we presented on our website, which has a media library and includes some of our upcoming events as well. Here is our disclosure from the AACN. Please review the disclosures on your screen. We'll review a few things before we begin. The session will be recorded and it will be available on the Jonas Philanthropies website. At the end of the session, you will be automatically directed to a program evaluation, which will also be sent to you in a follow-up email. Check your junk mail if you do not receive it. In addition, one continuing education contact hour is available for attending this webinar. If you would like to receive credit, please complete the evaluation. At the end of the evaluation, you will be able to access the certificate. We appreciate your feedback to this evaluation. And now I will turn it over to Lieutenant Colonel Chris Stuckey, one of our Jonas Alumni Council members, who will introduce our speakers.
Greetings, I am Lieutenant Colonel Christopher Stuckey, and I was a 2016 to 2018 Jonas Scholar. I earned a PhD from Uniformed Services University in 2017. I'm currently an active duty nurse scientist at Fort Bragg, Womack Army Medical Center, the Center for Nursing Science and Clinical Inquiry. I'm a member of the Jonas Scholar Alumni Council, and Jonas Philanthropies supported my dissertation research. The purpose of the Alumni Council is to provide advice to Jonas Nursing and Veterans Healthcare about strategic direction and make key decisions for the Jonas Scholar Alumni Group, and to create a mechanism to foster a strong and long-term network among the widely dispersed Jonas Scholar alumni and to maintain a connection between the Jonas Scholar alumni and Jonas Nursing and Veterans Healthcare. It is an honor for me to introduce the esteemed speakers. Dr. Stephanie Hossley is an assistant professor of clinical practice in the College of Nursing at The Ohio State University. She earned a Doctor of Nursing Practice from there as well. She serves as the College of Nursing faculty for the OSU Leadership, Education, and Neurodevelopmental Disabilities Training Program. She is an advanced practice nurse, and she practices healthcare in the Complex Healthcare Clinic at Nationwide Children's Hospital in Columbus, Ohio. Her interests include management of sleep disturbance in children with neurodevelopmental disorders. Also from the Ohio State University is Dr. Karen Moss, who is an assistant professor there. She earned a PhD from the University of Virginia. She is a Jonas Nurse Scholar alumni and a certified clinical nurse leader. Dr. Moss has practiced mostly in the adult critical care setting. Her program of research focuses on improving advanced care planning, pain, and decision-making outcomes for African American older adults with dementia and their family caregivers towards improving quality of life.
Thank you for that wonderful introduction. Very, very kind. Good afternoon, and thank you all for taking time from your very busy schedules to join us for this webinar on career planning for the PhD and DNP prepared nurse. We are delighted to be here. I am Dr. Karen Moss, Assistant Professor in the Center for Healthy Aging, Self-Management, and Complex Care here in the College of Nursing at The Ohio State University. And here with me is...
Hi, I'm Dr. Stephanie Hosley. I'm also an Assistant Professor here at The Ohio State University in the College of Nursing, and I teach in the Pediatric Nurse Practitioner Program here, as well as practice in the Complex Healthcare Clinic at Nationwide Children's.
So career decision-making is a major undertaking that is best completed with consideration of the multiple potential outcomes. Therefore, it is in one's best interest to take time to explore each option that will be available following graduation. Whether the choice is academic or industry or both, a plan should be in place for successful execution. The purpose of this webinar is to discuss strategies for successful career planning following your Doctor of Nursing Practice or Doctor of Philosophy in Nursing degree preparation. These will be largely based on our experiences, and the goal of this is for more of a discussion.
At the end of this presentation, the participants should be able to discuss some of the career options available for both the DNP and the PhD graduate, as well as strategies for obtaining that dream career. You will also be able to use guided imagery to help you to discover the answers to the what's next question in finding that career, and discuss the role of mentors in the career planning process.
So we know that because of the many options that exist for you following graduation, you may find yourself being pulled in many or several different directions. Will it be academia, teaching and research, clinical, teaching, research and practice, or industry? Remember that these can also overlap.
When we begin to consider the options for the DNP prepared nurse, it's important to first consider the needs of our country and our nation's healthcare right now, including the increased complexity of patient care, as well as our national concerns about the quality of care and safety. That naturally correlates with how the DNP is prepared to practice, not only as a leader in nursing practice, but also to help to translate research into practice and translate that knowledge into practice. If we think about some of the categories that some of the options would fall into, it naturally falls into both the clinical, the academic, and the community arena. With the clinical options that are available, the nurse executive is an ideal option for a DNP prepared nurse. We know that we are trained to be leaders and trained to improve health outcomes, and that naturally falls into the quality improvement expert. There are some specific organizations for quality improvement, such as the Helene Full Trust National Health Institute for Evidence-Based Practice in Nursing, that we are fortunate enough to have here at our institution. But even without that particular organization at your institution, there are numerous opportunities for QI or for quality improvement in your particular organization. Also, not to forget the importance of the informatics officer, and that the DNP prepared nurse quite naturally falls into that role and qualifies to fulfill and execute that role. Considering the academic arena, we know that there is a shortage of doctorally prepared faculty. So the DNP nurse is quite naturally aligned with that, even though we're not specifically educated to be an educator, so to speak. We do possess the qualities, the qualifications in order to fulfill that role and teach our next generation of nurses. And then finally, in the community arena, again, when we consider the current status of healthcare in this nation, we know that there are changes to be made, and the DNP prepared nurse quite naturally falls or can fulfill the role of both the policy advocate as well as leadership in some of our professional organizations. In order for us to make the changes that are there, we need to have a seat at the table, and so the DNP prepared nurses definitely qualify to fulfill that seat.
Excellent. So in addition to many of the options that Dr. Hosley just spoke about that are available to our DNP prepared nurses, PhD prepared nurses oftentimes will see postdoctoral fellowships upon graduation. Not always, but it is an option that's available, and it's a great opportunity to delve into your program of research, get it started, get the exposure that you need with, or additional exposure to research that is needed, and also focus on your scholarship, your scholarly writing and publications as well. Oftentimes folks think or of the concept that after completing a postdoctoral fellowship, one must become a faculty member at a R1 or research intensive university. This is not always the case. So this is a good time, the postdoctoral fellowship is a good time to explore different options and put some considerable thought in what your next step will be. So additionally, persons may choose to go directly into academia as a faculty member, and oftentimes, depending on the university that they're attached to, there is an option for the tenure track or the clinical track. And the clinical track is typically non-tenure related, but again, these specifics are determined by the institution that you're a part of. And when we think about clinical opportunities, there can be opportunities within organizations such as a cancer center that may be attached to your university or a medical center to have more of a research role as a PhD prepared nurse, such as in oftentimes our cancer centers that are associated. And then when we think of industry, oftentimes there are opportunities available for PhD prepared nurses to work with insurance companies or pharmaceutical companies in the research role. One of the things to consider is the fact that often what the research agenda that is put forward is often what the industry or the organization sees as their priority, and not always aligned with whatever the individual PhD prepared nurses research or program of research was more so aligned with. So that's something to keep in mind as you look at opportunities that may be available to you. And so when we think a little bit more about the clinical versus research track, again, these are hugely dependent on institutional guidelines. So as you interview different places, be sure to ask. Oftentimes you have to select which track you're interviewing for in advance, but getting the details on what the expectations are along whichever track you choose to pursue is hugely important. Usually promotion, whether it's clinical or research track, happens along the way. Typically for the tenure track, it's 6 to 9 years towards tenure. And the requirements do vary. You want to find out about what the requirements are for grants and being successful or seeking grant opportunities. Also for the number of publications that are required on an annual basis, as well as the service commitment or the level of service that's required. And also teaching, which we'll talk a little bit more later. Also, annual evaluations are typically a part of the process, regardless of the track that you're on. And it's a time to, not necessarily fear, but to have a moment to get feedback from your mentors on what you're doing well, and then, of course, areas for improvement, because we know there's always room for improvement, and just being open to that as part of the process, so that when you do go up for tenure, you're, assured that you're meeting the mark for all of the different metrics. And research and scholarship are extremely important, especially if you're on the tenure track. Teaching, whether or not you're at a research one or research intensive university, teaching is always very important because we as faculty are here for our students. So, don't be mistaken in thinking if it's an R1, teaching is not viewed as being important, but teaching is very important. So you want to ask questions about expectations for your role as a faculty, as an educator, and coming in the door, what those are. In terms of service, this is one that junior faculty tend to find themselves overcommitting in. So it's always good to find out what the expectations are and making sure that we're not overcommitting on our service commitments, because, by doing that, we have more time taken away from our research and scholarly activities, which is just not a good thing. So we always want to be mindful of that. And do you have anything else to add, Dr. Hosley, as it relates to these?
Thank you. The things that I would add would be, again, this is dependent upon your institutional guidelines. Typically, or here for us at our institution, the options for the DNP prepared faculty are either clinical track or associated faculty, with the difference being the clinical faculty definitely has the expectations of teaching as well as clinical practice, and then the potential for scholarship, whether that be case studies or clinical reviews, or developing evidence-based protocols or other scholarly work. Whereas the associated faculty, the requirements or expectations include just teaching and practice, and there's no requirement or expectation of scholarship. So again, that would be dependent on your individual institution.
Thank you. So speaking of the institution, as you consider where it is that you want to land for your first role, location is very important, considering whether or not you are mobile. Are you restricted to the geographic area that you are for your doctoral program? And these things you will know, based on where your family is and family commitments, if there's a spouse and spouse's jobs, and all of these things help to weigh in on whether or not you are able to move for the purpose of your next position. And then opportunities for collaboration. And this is something you will probably be thinking about even before you interview. So do you know someone in your field of science who is there already, whether they're in the College of Nursing that you're seeking to be a part of or not, or whether it's a clinical role, whether you have someone there who you can collaborate with or potentially work with very closely. Resources available. If you're, for example, involved in clinical practice, you want to maybe have an affiliated medical center or institutes, again, such as the Fold Institute, that you can find yourself closely aligned with to move your work forward. And then the culture of the organization, again, is one that's hugely important. And this, is something that a mentor of mine shared, that when you interview at these places, you will get a sense of what the culture is and whether or not you will fit in coming in the door. And I, to be honest, thought, well, it's only going to be a day or two. I don't think I'll be able to determine that. But, the fact is you do get a good sense of whether or not you might be a good fit within an organization by, talking to folks, be it junior faculty, senior faculty, students who are there while you're going through the interview process. And then the last point on this list, the imposter syndrome, we all have some sense of what this can feel like. And Dr. Hosley, do you have anything you want to share related to that?
Just to keep in mind that we all have some level of anxiety anytime we start on a new path or a new opportunity. And so it's important to remember when you are there to fight against those feelings that you don't belong here, that you're not qualified to be here. If you've reached this point in your journey, if you've reached this point on your path, then you've met the qualifications to be where you are at. It's a matter of finding the institution and the organization that fits with your qualifications. So be intentional about trying to push away those negative thoughts that you are where you are supposed to be. And it's just time for you to figure out how that institution works with you, not that you don't belong there.
Wonderful. And I just have to add one more point about how important it is to align your personal and professional priorities as you embark on this venture, because the two just go hand in hand. And then when we think about mentorship, often, there are various types of mentors. They have different roles. Their purposes vary. Oftentimes, it can overlap. So one person may cover more than one role as one of your mentors. But definitely we all conducting research as junior scholars need to have mentors for our research and scholarship. Oftentimes they're in our areas, help to pull us up and introduce us to folks, just as we had happen when we were in our doctoral programs. If it's teaching, we all could use this as well. Even if you've taught before, but being at a different institution, sometimes there are policies and procedures that you may not be aware of, that a mentor for your teaching will be good to have as a resource. And then for acclimation to academia, this person can be at any institution, but just have the experience of being in academia and sharing to help guide you along that process towards promotion and or tenure. And then if this is somebody who's at your institution, they can help you to navigate policies and procedures related to all sorts of things specific to your institution. So that person would have to be local to you. And then other professional development things that just kind of comes along with the territory of moving through academia. You can find mentors to help support you in that way as well. And also personal aspects of you and moving forward and being your best self for your work and of course your personal life. For example, if you are raising young kids, or if you are caring for aging parents or a sick loved one, oftentimes you can have somebody who has gone through or is in this role as an academic or a clinical scholar who may have had a similar experience and can give you guidance on how to best navigate the dual roles of being a caregiver and being employed in your respective role. The other thing to think about when it comes to the personal aspect, and we oftentimes wait to think about this, is retirement. So finding a mentor specifically who maybe has retired well, somebody that you think has done a good job of preparing to get their perspective on retirement, and or what worked well for them or what they wish they would have done prior to retiring would be a good way too, because oftentimes we think coming in the door, retirement, down the line, but it's not so far away, perhaps. So we should think about those as well. Dr. Hosley, do you have anything else to add?
Just when you are beginning the process, just to remember again your needs. What is it that you need from the mentoring relationship, and which area of your life is it that you need? Whether it be your role as an academic or whether it's in your clinical practice, knowing that you may need more than one person to fulfill your needs as a mentee, and also what support does your organization offer? Some organizations will give dedicated time to the mentoring process. Some will have a formal program to help connect you with someone in your area. So, looking into those opportunities when you're considering an institution or when you are beginning the process. And then what support it is that you need from the mentor. What area or is your challenge area that you need from them, and making sure that you also inquire what the mentor expects from the relationship, because it's a mutually beneficial relationship, and you want to make sure that the needs of the mentor are being met as well, so that they feel like they are fulfilling that role. And then finally, what are you willing to contribute to this? This is not just, oh, I have a mentor I'm going to meet. What is it that you're willing to contribute? You have to be able to communicate those needs. You have to be able to communicate on an ongoing basis if there are challenges with the relationship. And you have to be willing to learn. When the mentor is explaining things, it may not be exactly the same path that you would have taken, but there is something to gain from that knowledge and that experience. So having that willingness to learn, and then finally taking that initiative to request feedback. You may need more feedback from your mentor. The mentor may not know exactly what it is that you need. So again, that goes back to communication and just being intentional about this relationship, that it's not something that just happens, but there's some work that needs to be put into the relationship. What else would you add?
So just all wonderful, wonderful points. Thank you. So just, if we could ask our listeners to kind of just remember what it was like to prepare and submit their first publication, or teach for the first time, or when you entered clinical practice as a bedside nurse or an NP, and how important the role of your mentor was to you with that process as you move forward to, remember, of course, you're reaching up to your mentors for help, but also to reach back to those who are coming up behind you. Extremely important, and it is fulfilling as well. And so when we think about resources along those lines, so there are, books, there's journal articles related to mentorship and moving forward in academia. The Chronicle of Higher Education is one that puts out a lot of really relevant topics. In terms of salary, the AACN, or American Association of Colleges of Nursing, has a book on salary, and they divide it up by region, whether it's 9-month or 12-month, and give you the breakdown of what salaries can look like. So as you navigate the process of interviewing and negotiating salaries, you'll have something concrete to look at as a reference point. Also, make sure that the publications or books that you look at are relevant to today, because 30 years ago is not exactly the same as it is today. So think about that as you choose your publications to take a look at. And then the other bit of advice I would give is to make a priority list. We talk about the importance of personal and professional and alignment. What are the things you want in that next position? Assign weights to them is something that a tip that I got from a peer mentor, actually. So assign weights to whatever the priorities are on that personal and that professional list, in addition to the qualitative data that you'll collect each time you interview and sit down and kind of debrief on what your thoughts are based on the experiences that you have. And it was really helpful to look back at that and help to quantify kind of like a mixed methods process as you make such a big decision.
One of the additional things to consider when you are on this journey is becoming certified or becoming a fellow. So why is certification important? Well, we need to validate our skills and our expertise, or it's one way to validate our skills and our expertise in whatever your particular area is, whether it be in pediatrics or in mental health care. There are certifications that you can obtain through the many different certifying bodies that will just be another thing that you can use, and you can use to leverage your position, that you have the expertise in that area. So for myself, I actually am certified with both my clinical practice as a primary care nurse practitioner, but I also have certification as a certified nurse educator. So that also validates my expertise in the academic arena as well. So there are multiple combinations that can be used. And so those are just important to consider. And then there's also fellowship, which I believe you're going to speak to.
Yeah, so, if it's a practice-related organization, for example, the fellowship in palliative care nursing, or FPCN, oftentimes depending on whatever your specialty area is, organizations that are interdisciplinary that actually focuses on research and practice, such as the Gerontological Society of America. You can seek fellowship status there with the FGSA. And then, again, if you're more so, for nurse practitioners in particular, there's the FAANP, which is a fellow in the American Academy of Nurse Practitioners. Or if you're more so research focused, the fellow in the American Academy of Nursing, or FAAN, would be something to consider. And oftentimes, again, as junior scholars, we think it's too early to begin preparing, but at least taking a look at what the requirements are for some of these will be really helpful, because again, when you look at moving towards promotion and tenure, these things all count, and they work in your favor.
It's also important to remember on this journey, having a collaboration or a collaborative role with your colleagues. So we're discussing the role of the DNP and the PhD, or the career opportunities available for the DNP and the PhD. And it's important to remember that we can go on this journey together. The PhD, their role is to generate that knowledge, and the DNP is translating that into practice. It quite naturally falls that we should work together. So again, being intentional about seeking out that role, just like you are going to seek out that mentor to find the PhD that you can work with. And you can begin this part of your journey even when you are still a student. And encouraging that of your students if you are an educator. For Dr. Moss and myself, the first conversation that we had, we discussed how can we work together. It's a team effort. Both of our objectives is to improve the health outcomes of the nation, then it quite naturally falls in line that we should work together with that.
Excellent. And, you know, the number of nurses with doctorates is small, and we all need each other. So excellent, excellent points. I could not agree more.
So this is a journey, right? We need fuel for the journey. We have to make sure that we are able to complete the journey. So one of the things that we want you to be mindful of as you begin this next step in your career path is that you have to take care of yourself. In order to implement all of these tips and all of the big decisions that we are considering at this point in time in our career, we have to take care of ourselves. Sometimes your institution is very helpful in supporting. For us here, wellness is incorporated into every aspect. So if it comes to a standing desk, or we may receive an email that let's go take a wellness walk, and whoever can come can go and walk. Whether or not that is in place at your institution, you have to be mindful to schedule it in. We know that sitting is the new smoking, and so yes, we don't want you to smoke either, but we also want you to make a conscious effort to get up and stand at least once an hour. When you schedule that meeting with your mentor, when you schedule time to look at the institution that you're interested in, schedule some time for exercise, at least 5 times a week for 30 minutes a day. Make it part of your calendar so that you have to do it. And then taking a time to be mindful, take some time for meditation, to be in the moment, to take some time and relax. And that naturally aligns with sleep and rest. We keep trying to add more and more into the day. You can't take away from that sleep if you're trying to complete this journey successfully. So making sure that you take that time for sleep. Like your brain and your body needs rest, it's important to disconnect. We're using an electronic platform right now to disseminate this information, and that's great. But it's important to remember that it's okay to disconnect from email or from the computer or your laptop, to disconnect from social media. Social media has its place, and we do a great job of disseminating new knowledge and points of interest. But sometimes you just need to unplug and remember that it's okay to step back and take a break. And then I think that Dr. Moss is going to talk to us about being kind.
Absolutely. So in the scope of the job hunt and this process, you know, practice courtesy when you interview. You know, even if you know that the institution is perhaps not your top choice, sometimes you can be pleasantly surprised. And just because an individual is not a colleague or boss today doesn't mean that they cannot be tomorrow. So, you know, just be mindful of that as you navigate this process, and be discreet. You know, when experiences are not so positive, because, you know, it tends to happen sometimes, stay upbeat and try to stay focused on the positives. And you know, I cannot say, I can say much more about that, but it's just so important for your own wellness and also for what you project. And then always say thank you. You know, some prefer to write handwritten notes of thanks as they leave their interviews, but even a short email saying thank you for your time, I appreciate what you shared, or I'll take, or I wanted to follow up, whatever it is that you left that meeting with that individual saying, because if you happen to take a position there, it's important to also cycle back to those persons with potentials for collaboration that you would have discussed. And the thing to remember too, even if when you get at an institution, somebody you may have interviewed with may say, oh, you know, I'm really focused on this right now, I may not have the time, but they can also be a great avenue to connect you with other persons who can be helpful to you moving your clinical or your research work forward. So always think about it as just this network. And if this person is not able to help and they can point you in the right direction, then it's always a win-win. And so we talked quite a bit about wellness because we do feel it's extremely important. And with that, the next slide we talk about, we transition to will help us to get a little taste of it, to do some intentional work as we breathe deeply. So you will hear some music with this next slide in the background, and you'll see an image. And if you can just go with us for just a little bit here. So we've come to the point in our presentation where we would love for you to be a bit vulnerable to yourself. You are probably seated somewhere. Get your feet flat on the floor, if you will. You may choose to close your eyes, or you may head to the beach via the image on your screen. And if you do that, you should hear the waves as they ebb and flow. You may even feel the water tickling your feet and the sand beneath it. So go ahead and take a few deep breaths. So deep breath in and out. Again, in and out. And one last time, in and out. And so think now of the year 2024, exactly 5 years from now. Where are you? What are you doing? What is your role? But most importantly, are you happy? So remember, much of this, thank you for allowing us to do that, by the way. But remember that much of this is in the power of your hands with this entire process. There will be things along the way that can happen just with life in general, but we must remain focused on our goals. Perseverance. And so in order to be able to respond with a resounding yes to the "are you happy" question, we have to do some goal setting. So just how every semester needs a plan, we are going to set some specific, measurable, attainable, relevant, and timely, also known as SMART goals.
So as you begin to think about these goals, it's important to consider, again, the process that should be in place in order to reach them. And so who might you contact as that potential mentor? And what will be your next step? Taking the time to write this down, not just think about it, but put it into writing. Be intentional, put it in front of you and make it plain so that you can begin the next step. And not only thinking about the goals, but accomplishing those goals and being able to move on to that next step where you plan to be.
Absolutely. And, you know, again, we know that this process can seem burdensome, but we have to find ways to make it fun. So as you think about your responses to these questions, think about this decision that you are so privileged to make today, and over that will influence your life over the next few years at least, and how it will impact the rest of your career as well, what it would look like. So it's a real advantage that we have to be able to do this.
So we've taken just a brief moment of your time to discuss some of the options for both the DNP and the PhD prepared nurse. We talked about some of the strategies that you can use to select your dream career and the role of mentors in that process. We also talked about the role of promotion and tenure, as well as certifications and fellowship status in helping you to get to that point along your journey. In addition, we talked about the role of collaboration between the PhD and the DNP prepared nurse, and the fact that we can't do this alone. We want to improve healthcare in this country, and so we need each other in order to do that. In order for you to be prepared for that journey, don't forget to take time to take care of yourself. Wellness is not just something on the list, it's something that you need to actively participate on a regular basis. We also talked about the answers to what's next, and we tried to give you a kind of a jump start to thinking about what's next, and we want you to continue to consider that and to continue to write down those goals and to continue on that goal-setting journey. And then Dr. Moss, would you like to close this out here?
Sure. So just a reminder to everyone listening to keep your eye on the prize. We must encourage you to dream, discover, and deliver as you continue to impact the lives of patients, families, students, and staff, and also peers that we are so privileged to serve in direct or indirect ways. You will rock this. And we know that our time together here was packed, and there are so much more things that we could have discussed. So please don't hesitate to reach out to us by email with any specific questions that you may have. The slide with our contact information is next. These are references that we use to put the slides together, and our contact information listed here. Thank you all for your time and attention, and enjoy the rest of your day.
Thank you so much, Drs. Hosley and Dr. Moss. That was an excellent presentation with full of practical information, your own personal experiences, references that I know our Scholar alumni can go back to time and again once it's published on our website. It's going to be a tremendous resource for our current scholars as well as our alumni, I'm sure, for a long time to come. So thank you again, and thank you also to Dr. Lieutenant Colonel Christopher Stuckey for his introduction and participation as well. And as a reminder to our participants, in order to evaluate the webinar, we will send everyone this link by email that we know that joined the webinar. And also, as a reminder, if you would like to receive the credits to completely follow the entire webinar and culminate with taking part in this evaluation survey as well. So on behalf of everyone at Jonas Nursing and Veterans Healthcare, we thank you. And once again, we salute our Alumni Council. Thank you very much.
Thank you.
Bye-bye.